She's a doctor.
Hi, I'm Dr. Dovec, and she's a dietitian.
Hey, I'm Hannah Schuyler, and together we are the DoctorXDietitian Collab.
And today we have a very big announcement.
Very exciting.
It is exciting. And without further ado, because of the name of the title here, we at BodyByBariatrics are going to start caring for pediatric, adolescent, bariatric surgery patients and some medical weight loss as well. So we know that this is filled with, it's a complex topic, it's controversial. What did you think when I originally came to you and said, we need to do this?
I think you're 100% right. It's controversial. It's emotionally charged. Like there's a lot that goes into this. And then for me, I'm like, this is also just a different population than adults. So like, my brain just starts thinking of like, all right, what are all the considerations? What does the programming look like? How does this differ from my perspective for treating this population versus the adult population?
Yeah, I mean, there's a lot of skepticism about it. There's a lot of negativity in media or just,
there's a lot of dietitians that are not into this idea.
I know there's a lot of surgeons. It's a lot of, well, you can't do it. You shouldn't do it. These are kids. What about the long term? So today we decided that we are going to go very comprehensively in depth into this topic and just sharing with our listeners. Really, just like you said, what does this programmatic build look like? Like, what is the foundation? What does this look like? How do our patients get involved with this? And I think that all those considerations are so important. And we want you to kind of come with us live as we really start to make this program and we put it on our website and you really can see all of those things.
Yeah.
So the first thing I really want to start with is that we are taking this extraordinarily seriously, obviously. And when you're developing a new program, obviously you want great outcomes, it to be very safe, it to be effective. That's the thing about bariatric surgery, that it is still the most effective tool that exists to lose weight and to keep it off. And so we really want to be very thoughtful in how we're going to do this. And I think one of the things is, we're looking at these younger patients as truly patients.
Right. And just really quickly, what's the age range we're talking about here?
Yes.
Because I think people hear pediatric and they think like 7-year-old.
Oh, no, my friends.
No, not at all.
No, we're not doing that. So just so that you know, there's a lot out there right now with the Academy of Pediatrics and with the Society for Bariatric Surgery, the International Society for it. So all of these, there's a lot of great evidence, volumes of it that really support it. And they're saying to think about it at age 12 and up. Wow. We are not. We are starting with ages 15 and up. So we were before doing ages 18 to 80, and now we're 15 to 80.
Yeah,
I would say. And we really, again, there's a lot of different things, but there's also a lot of similarities to people struggling with their weight. Again, it doesn't matter what your race is, your age is, I think your gender, there's a lot of similarities here.
Yeah.
That it's not like we're really reinventing the wheel too much in this whole thing.
I think from a surgical perspective, it's the same. Because the anatomy is the same, the physiology is like all of that. I think when we really dive into this and what we're going to obviously focus on and make sure that we're doing correctly is making sure that these people are prepared and ready for this life change.
And to make sure that they are prepared to have sustainable results too. For the long term, the follow-up. There's been a few studies that have come out recently. We're going to get into really what is the up-to-date literature, what are the guidelines for this out there. And a lot of what we're reading about is that the long-term effects are long-lasting in the pediatric population. And that is what, to me, makes it that we have to do this.
Yeah.
We have to do this. So the first thing is we need to get to know our patients and really their whole environments that they're in, because it's not just the patient though. It's also their family, their support, their caregiver. Understanding their living situation is so critically important. Like, who are their caregivers?
Right.
And what are their habits like? What is their lifestyle like? All of those sorts of things.
Yeah. And that goes along, and we'll talk about this too, is like this multidisciplinary approach to it, where we're looking at, and we always look at our patients as holistic people. We're not just,
Mhm.
like, great, there's just this one aspect of it. We know that weight impacts a lot of different areas. But when we look at this population, we know that it's even more of a consideration, is what does their home life look like? Who's making the food? Who's shopping? Who's doing that? And those are all things we're gonna be chatting about and considering.
Yeah, those are different layers of already a complex type of a
Yeah.
thing, and that's it. So, when you look at patient or you look at, in this case, a teenager, an adolescent, the very first thing always is like, why? Like,
Yeah.
why do you want that? And that's also something that we really want to assess their maturity because I mean, you want to make sure that they're also thoughtful
Yeah.
and why they want to do this. Like, how do you see your life if you weren't obese? There and the kids, my God, bullying and being just victimized. Into my reading, there's a lot of kids who are actually homeschooled are the ones that decide to have bariatric surgery because
Oh,
their
okay.
weight is just impacting them on a mental aspect and just,
Yeah.
depression, anxiety, like I just don't want to go outside, all of
Right.
those considerations.
And just, I would imagine, ability to participate in the day-to-day activities of being a teenager.
Yeah.
Whether that's going shopping with your friends, whether it's participating in sports or social clubs or theater or dance or anything, the arts. Like, I think any of those things can be impacted by, and again, when we're looking at this is for a patient with more severe obesity. This is
Mhm.
not somebody who's a little bit overweight, but it really can be impactful on that um, day-to-day living.
Yeah, so that brings up a good thing. So who even qualifies?
Okay.
So the qualifications are very similar to the adult ones, which is based on BMI, body mass index, and in the pediatric population, we're looking at a BMI of 35 to 39.9 with those metabolic comorbidities
Mhm.
like the sleep apnea, high blood pressure, diabetes. You will qualify. Insurance covers this.
Mhm.
Insurance covers this. And then if you don't have any, but your BMI is over 40, you qualify based on your BMI alone.
Right.
And obviously, that's a lot of it's based on there's the growth charts and there's the percentage of where you fall and the weight on those charts. And
Yes.
for these ones, you qualify typically if your BMI is greater than the 95th percentile.
Uh-huh.
So that is another way of looking at it because we're getting referrals for this sort of weight management program from pediatricians.
Right.
And this is also, you know, nobody. We're gonna make sure that no kid is gonna wake up and be like, "Oh, I'm gonna go try surgery," or no parent or no caregiver or no anybody is going
No.
to think like, "No, we're gonna try the non-invasive methods
Yes.
first," obviously. That's gonna be at the forefront. But maybe you've done the diets and
Mhm.
you've done, you've been supervised by your pediatrician who's probably just like in the adults, like completely overwhelmed
Yeah.
by all of the other responsibilities and then the complexity of it. And it's like, oh, we have a 15-minute visit, like,
Yeah.
have you thought about losing weight? Like, yeah, every
Of
second, just
course.
like
Yeah, every second of
everybody.
every day I've thought about it.
Yeah,
And
and I think that, this is something that we will obviously look at their weight history, their diet history, their exercise, like you said about sports. This is where you're kind of like figuring out what it is you do like.
yeah.
And if you can't participate because your weight is holding you back, like
Yeah.
let's do it. And so we're also going to be looking at medical weight loss. So I just
Mhm.
want to touch on that a little bit. So who qualifies for medications? Same as the adults,
Mhm.
BMI 27 to 29.9 or 30 and above. And that is not an arbitrary amount of the population, actually. In 2016, this is what I looked this data up from
Yeah.
the WHO, the World Health Organization. 340 million Americans that were children or adolescent were obese.
Wow.
That's a crazy number. And then 8.5% of all adolescents, or 4.5 million of those ages 12 to 19, were greater than the 95th percentile that would qualify also for surgery.
Wow.
And the problem is there's just not a lot of programs.
Mhm.
It's a very, the traditional programs, which is a bricks and mortar, come on into the building, see an exercise physiologist in this room, a dietitian in that room. Here's your, there's very few physicians that are trained, that are pediatrics, that have done additional obesity. These programs there's just not enough to take care of that.
No.
So we want to do something that's, really easy and that sort of thing, to hopefully be accessible, convenient, and most importantly, effective. So looking at the medications, right now they're orlistats.
Everyone's favorite.
I know, and
Make you poop your pants.
yeah. So we're not going to be doing that one, but that one is FDA approved for ages 12 to 16.
Yeah.
It works on the absorption of fats. It's a malabsorptive of fats, and so therefore you do get these like greasy stools and diarrhea, and
which I think in the long run just makes you food avoidant.
yeah,
and just so that you're preventing those symptoms. It's not even that like you malabsorb that much. It's just you stop eating some of those things.
And like high fat is typically like not even the culprit. Like, okay, I can still eat a sugary, icing off a cake or something.
Yeah.
Like, oh, okay. So there's orlistat, which we won't be doing, and I don't think there's many that would recommend that. And then for decades and decades, there's phentermine or phentermine plus topiramate, which is Qsymia, but that's in ages 16 and up. And I don't know how often I would do that one as well. And the reason why I would be hesitant, for those of you who maybe have not listened to our medical weight loss topic on this, phentermine mimics the sympathetic nervous system. So it is a sympathomimetic amine. So it is something that really just makes your, that fight or flight running through the woods. We talked about that a lot. But with that being said, I think that the impact on sleep, I think that would be the biggest hesitancy I would have with that one.
Yeah, and that makes sense because especially with when we look at teenagers' sleep schedules and sleep patterns, they're already so skewed, and school starting at the time that it does really for a lot of kids doesn't fit with how they should really be sleeping even. And so then you're adding in a stimulant medication to that, and I could see that being
I don't know if I would want to go there because it would be so disruptive, or kids and teens need more than
they
sleep
need
at all.
a lot of sleep. Absolutely. And they don't tend to get it. So
there's a lot of cognitive brain power, even just physiology there, that I wouldn't want to mess with that. So in late December of 2022, early 2023, Wegovy, which is basically semaglutide, the same as the Ozempic craze, is now approved for adolescents greater than 12 years and up. So if you're 15 and up and your BMI is greater than that 95th percentile, you qualify as obese. We, would love to have you. We already have a comprehensive program, as maybe that would be your first line treatment, or maybe you've already been working with your endocrinologist. Maybe you have diabetes. Maybe you're already on like an Ozempic or something, and it's, maybe not as effective, and you're already ready for surgery.
Yeah, I think it's a great opportunity too. And we'll talk more on this on the wait and see kind of theory and watch and wait. But those medical interventions can be good, and looking at people whose BMI is a little bit on the lower side, who might not qualify for medication, but maybe we can get them, or might not, I'd rather qualify for surgery, but maybe we can get them in to prevent them from getting to that place as well.
Absolutely. And that's like what you just said about the wait and see. Let's just go there.
Yeah.
So a lot of the data exists, and like we already said, in adults, this has been our hard-won battle with referring providers, again, with society, with a lot of people thinking just eat less and move more. What is wrong with these kids? What's wrong with these parents? Shame on you. Shame on you. And as a parent, I will tell you, yes, I have little kids, and I mean, my God, I obsess over this. Like, I thought I would be able to have control over that. If you were to see this, Hannah, like, it is something that it is like, don't restrict them, because you don't want them to sneak food or feel that, like, you hate that stuff too.
Yeah. And it's such a hard line of, and I think a lot of us who grew up in the 70s, 80s, 90s, experienced a lot of that more diet culture that
Mhm.
has been programmed into, and now it's like the clean plate club, and it's this, and it's, all the processed food that we know has become much more accessible and everything. But yeah, it's finding that balance between providing your kid a nourishing meal and
Mhm.
not restricting them to an unsafe and unhealthy degree. And that's what people really have an issue with. I think one of the big things with the surgery as well is they're looking at it as, are we just creating an unhealthy relationship with food, starting with these kids when they're kids and they're teenagers.
Mhm.
um and I think that if we really take a step back and look at these kids and the weight that they've gained in this short amount of time of their life, because they haven't had that many years to have
Mhm.
done this, is really when you can step back and see, like, oh, this is probably not a lifestyle issue,
Right.
or not solely a lifestyle issue. Again, I will always say, does lifestyle play a role in obesity management? 100%.
Mhm.
That's my job in all of this, is to look at
Mhm.
lifestyle and diet and other things. But are there other things that are factors that are going into it? Yes, and that's where we see the success with surgery, and where these kids will probably, just benefit from an earlier intervention, because like you're
Mhm.
saying, it's this watch and wait.
Yeah, the watchful waiting is not appropriate. That is a
Yeah.
direct quote from some academic specialists in this topic, that some that have been doing this bariatric surgery in teens and kids since the early 2000s.
Mhm.
There's a few long-term studies, and I think that's always a hesitancy, even in adults. Like I
Yeah.
hear all the time, like, all right, well, what will happen if I get cancer when I'm like 20 years from now? Or like, what's it going to be like when I'm old? Like, am I 80? Like, how is it living with the gastric bypass long term, or the
Mhm.
sleeve, or any of these surgeries, and what does that look like? And I get it, like, the fear of the unknown. Like, I don't want in a 15-year-old to set them up for like, okay, you lost some weight. Now I set you up for the next, gosh, there's a lot of life to
Yeah.
live, 70 years of what have I done? Like,
Yeah.
wow, this is so permanent. This is, like your kid can't even get a tattoo without your permission. So
Yeah.
like this just feels like a lot. But, and everything, the most fascinating thing, the big hypothesis is, how does age play a role into the longevity of it, the success of it, and even the long-term sustainability of the resolution of the comorbid conditions, the other, metabolic issues related to weight? And the big hypothesis that is being answered, the big advantage, is that the degree of comorbidity or other disease, obesity-related condition resolution is much more robust when you have surgery in childhood.
Mhm.
And that's, like, jarring to me, and that whenever I kinda saw that in there's been some more studies as of late that are, like, coming out, the American College of Surgeons, there's, like, a longitudinal assessment, it's called the Teen Labs study. There's, other ones where they followed them for 15 years, and they looked at the outcomes. The thing that's just incredible is that, again, there is a counter argument to this wait and see approach, that watchful waiting is just not appropriate, that you're only just allowing time for things to get worse because
Right.
you're thinking, I don't know this population. I don't want to touch this. This is scary. I don't want to be
Mhm.
the one responsible for it. So I'm just going to wait till you're 18 years and 0 days old, and then
Yeah.
and then we'll talk. And that's how a lot of us feel like
Yeah.
about it. But again, that's not appropriate. So there was in 2022 in the Journal of the American College of Surgeons, there is a study that was called the long-term outcomes after adolescent bariatric surgery. They're looking at it in terms of total body weight loss.
Mhm.
So if you are 300 pounds, and with this, they're saying that they maintain at 2 years the average weight loss on all the patients they studied, which was about 100 patients, was they kept off 44% of their total body weight loss,
Wow.
which means that, they were 300 pounds, that 2 years past surgery, they kept off about, 140 of it or so.
140,
Yeah.
yeah.
So, and then at all the way up to 15 years, they kept off 32% total body weight loss at 15-year follow-up. And that the quotes from the article were the things that were just the most incredible, that over 90% said that they were happy and would have done it again. because they felt it was foundational in setting up their lives for something that they would have never imagined if they were bigger.
That they felt like they couldn't do before.
Exactly. They were graduating college. They had families. I
Mhm.
mean, these kids are now, no longer kids. Some of them were 16, 17, and now they're in their 30s.
Yeah.
And they have kids of their own.
Yeah.
It set their kids up for better eating patterns. And that's something that I'm like, wow, like how different your life would be. Think about it. If you're listening and you struggle with your weight and you had bariatric surgery in your 30s, your 40s, your 50s, your 60s,
Mhm.
would life been totally a different trajectory in every way, shape, and form if you would have done
If you'd
this
done this earlier.
earlier?
Yeah. Yeah, because there are people, and I talk to people about this when I'm assessing them, kind of like, when did your weight really start to become a problem? And of course, there's some people who it comes later in life,
Mhm, mhm.
especially we see like women after pregnancy, and like there's certain populations that we do see, or maybe they have just such a strong family history of diabetes that they develop it later in life or things like that. Whatever, life happens, you get it later. But then I do have patients who say, I've been big as long as I can remember. I started Weight Watchers when I was 12,
Mhm.
and I've been dieting on and off for the last 20 years, and nothing has worked. And it's like, imagine not just like what physically you can do, but mentally and emotionally, if you weren't on that cycle of dieting, losing, regaining,
Mhm.
dieting, losing, regaining, just that constant roller coaster. I think
Mm.
it's draining from all aspects. And then, like you were saying, I think to me, what's really going to be the best outcomes for these is prevention of these chronic and serious illnesses that like type 2 diabetes, like cardiovascular problems. I mean, we are seeing those things. Type 2 diabetes used to be known as adult onset
Mm.
diabetes, and it's not anymore
No.
because we're seeing it in these earlier populations. I mean, you're seeing kids develop type 2, and they're like, to start, sometimes they're not sure if it's type 1 or type 2 because type 1 was always only seen, the only one seen in kids, and now it's not.
Mhm.
And I think, when we think about the quality of our organs over time, which I don't think a lot of us give a lot of thought to, where all of our organs fail over time. That's just how it that's just how it is. Our kidneys are always working. They're going to get weaker over time. Our heart, our pancreas, all of that. But if you add in a chronic disease to that, and you can stop that early or prevent that from happening in the first place, like that is going to slow down so much,
Mhm.
you
Oh,
know?
without a doubt, and I think that that's some of the research that goes hand in hand with
Yeah.
that the severity of the disease, which becomes much more significant over
Mhm.
time, you can stop, reverse, prevent
Yeah.
everything. I mean, fatty liver disease is probably
Mhm.
one of the best examples.
Mhm.
I see people in their 30s. This
Yeah.
isn't like, like end of life age here
No.
that have early cirrhotic changes. They have nodularity to their livers. Their
Yeah.
livers are showing as starting to have some abnormality in their function as with the liver function test and the blood work we get before
Right.
surgery. Like, oh, should we even give Tylenol preoperatively because we're worried about
About
the
the
health and the
actual
function
liver.
of your liver?
Yeah. And that's non-alcoholic. These are a lot of times too, we see people that don't drink or very
Right.
rarely drink, nothing crazy like that. So yeah.
Exactly. I mean, I think there is lots to be said with the metabolic
Mhm.
improvement, just like with adults. And I think that that's it. Now, looking at the program of
Yeah.
like, how does this look for a kid to feel, that you feel comfortable in going for this? These are minors,
Yeah.
and you need a parent, a guardian, a very informed consent.
Mhm.
You need an actively engaged support system, really great open communication,
Mhm.
making sure that they all really understand what you need to do
Yeah.
and know that there's like lifetimes of kind of things and habits beat into you. And just like anything, like how do you change thinking?
Yeah.
Well, like I always say at the initial consult, I'm like, Hannah, I say this all the time. I'm like, she's so cool because she does just get like, she's not going to just push the agenda that's standardized on
Right.
everybody. It doesn't work.
It
It
doesn't.
will never work.
Well, and it's almost like and for a lot of people I think it's breaking generational
Mm,
trauma and generational habits and these things that, people who have, the parents of these children or the guardians of these children can take that higher look and can take that step back and see, because maybe they experienced what their kid is going through
Oh,
when they were
yes.
growing up, and maybe they've always struggled with their weight and they don't want to see their kid going down the same path, because again, we know that obesity is related to genetics. There's a huge genetic component in it, and so I think there's a lot of familial recognition of these types of things. And I think, as anybody, you always are trying to make sure that the next generation has it better than the current generation,
Oh,
right?
so
And so
true.
I think that's where, but I think it is very going to be very important for these people and just like with anybody, but I think especially in this population, to have that very strong support system at home.
Mhm.
Um,
Yeah, and I mean, the thing is, a lot of kids or childhood obesity may start, let's just put it all out there, from these kind of adverse childhood experiences. That's the medical term for it. It's like when things are not great in the home front.
yeah.
Divorces happen, abuse happens,
Mhm.
whether that be sexual, emotional, physical. And these are the people that sometimes, I mean, they can't get out from that. These
Yeah.
are the ones that have to be paying for the therapy appointments, for the co-pays. Like, do you even have insurance? Maybe you
Mhm.
don't. Maybe your insurance excludes it. What? Pediatric bariatrics? No way. Self-pay, like, the
Yeah.
timing of all that sort of thing. And so that's something else I really want to make sure that we're just so deliberate on. And
Yeah.
that is the support. First of all, we have a support group on Facebook. We are, we're on TikTok, we're on Instagram. We
Yeah.
do all telehealth. Like, I mean, I'm kind of excited for the kids to teach me.
Yeah.
Oh, I didn't even know my patient portal could do that
Yeah,
feature,
right.
but we want to make it convenient so that they can get that, and hopefully we'll develop, quite a few patients that together can have their own kind of spin-off to the spin-off of the support
Yeah.
group, and then a support group for families or for
Mhm.
their friends, and maybe the most supportive person isn't a traditional, of course, mom or dad or
Yeah.
even grandparent. It might be a neighbor, somebody that watches, a babysitter,
Yeah.
all of that kind of stuff. There's
Right.
all of those considerations about who influences your life.
Mhm.
And I hope that, surgery, I always feel like beyond the reason why I think people really like us and they feel like, oh, just like so drawn to it is because we do form relationships that are much
Mhm.
more than a traditional kind of,
Yeah. Absolutely. Well, I think it's accessibility too, and that's going to your point earlier of some of the reason that there's also been slow growth with this is because so much of this is such a traditional practice and program,
Mm,
and kids go to school. I mean,
yes.
Monday to Friday, like what, 8 to, I don't know what time school ends, 3:30 or whatever, but then your parents are working and maybe you don't drive and maybe the parents have to be there for appointments. So it's all of a sudden you're juggling a lot more considerations and scheduling and looking
Hmm.
at those types of things. And so I think that that's the other issue, is that everybody has tried to apply adult practices to adolescents, and that's just not necessarily going to work, because while we recognize that yes, surgery is going to be very similar, because you've said, what changes on the day they turn 18 is with their anatomy, nothing
Yeah.
is going to change. And but and even their home life may not change. I mean, I was still senior in high school when I turned 18. So what
Yeah.
difference does that really make? So kind of looking at this and not necessarily applying this adult centered program
Hmm.
to non-adults. Like they're different, it's a different population.
Yeah.
So trying to be nimble and trying to make sure that we're accommodating to the realities of being a teenager
Yeah.
is going to be key.
Exactly. Like, what topics do they want? What materials do
Mhm.
they want? How do they like it delivered? What works?
Mhm.
What doesn't work? I mean, from your standpoint, you have the lion's share of the lift here. Mine's the
Yeah.
easiest.
Yeah.
I said, I could do a 20-minute. I mean, oh my goodness, their anatomy, like I said, is so beautiful. And, I could do a quick surgery, but that is nothing
Yeah.
in my part is nothing in the scheme of this whole thing. And
Right.
it isn't with the adults either. It really isn't.
Yeah.
I just take the credit. But
Yeah.
I mean, it's like you and the program, the thoughtfulness, and even like maybe somebody wants to get into cooking, and like
Uh-huh.
you're gonna be like their first person that taught them how to
Right.
make some basic meals that are like,
Yeah.
affordable, easy, that
Easy. Yeah.
they can
Cook
do
in your
without.
dorm. I mean,
That's a good one.
geez.
I mean, that's a
Did
huge
you
point.
my dorm kitchen, I only lived in the dorm for 1 year, literally was a converted supply closet.
Oh.
I'm not kidding. We record our podcast in my husband's office, and it's the smallest bedroom in my house. It was half the size of this room. It was so tiny.
Oh, yeah.
So yeah,
I
you
don't
get
think we
it.
had one. We had like a micro fridge, which was a microwave.
Yeah.
By the way, as everyone knows, I'm a mean microwaver, and that's where my start.
Yeah,
That's
right?
pretty much the extent of it.
That's the extent of your cooking.
That was
Hey,
it.
I made full meals in my little dorm kitchen.
Wow.
Somehow.
Hannah, next level. That's what I'm saying. Like she's gonna be
yeah.
teaching all of you guys this
Well, and
stuff.
and then I think there obviously we know that diet is a component, and with that goes too. Of course, there's going to be a point where these people are going out on their own and living their own lives, but we have to pull back and look at the family life and look at who is going shopping for the food, who is cooking the food, what's the process for siblings. And I even with my adult patients I talk about this because obviously a lot of our patients have kids and they're like,
Yeah.
well, I need to make sure that the diet works for me, and then also is again looking back at not restricting the kids too much and letting them grow and
yeah.
so there is always that fine balance, but this is kind of the reverse of that. And I do think that we're going to also see kids that come through the program whose parents have done bariatric surgery. And I think that because, again, we have this genetic component, we know that this is going to be familial. And I think that's going to be a great, obviously, kind of way for these people to be really supported. Or they have parents who themselves, maybe they haven't had surgery, but they're trying to lose weight on their own too. And so it can be really that whole family buy-in.
That's that possibility is super cool to me.
Yeah.
I mean,
I see it happening.
I do too. I think it's incredible. Like, because that was another thing that made us think. People say, oh my gosh, would you operate on my child? And to me, like, wow, we've talked about this a million times, but it's one thing to get your spouse or to get your child, like, wow, like, obviously we don't take that lightly.
No.
And we really just, we want to make sure that we understand their history. We understand your family history, your weight history, your lifestyle, but also a big thing is that supportive, the behavioral health component, the mental health. And I think it's important to really get to the root of like what motivates somebody. And that is also goes back to the why and the level of maturity and those sorts of things. But, what do you really want to do? And even with a kid, like an adult, I never, ever, ever criticize, judge anything on their why.
No.
And what motivates you and how are you from a mental health standpoint right now? How is your weight impacting you? And making sure that, they understand the procedures, the long-term importance. And another big hot topic with this is the understanding of the absolute requirement, the necessity to be compliant with the multivitamin and the calcium citrate for life.
Yeah.
Because I think that's what people just hide behind that. Like, oh, well, I mean, you don't want malabsorption and
you don't want mineral deficiencies. But that's where the other thing, just to veer off on that for a second, that's where lifelong follow-up comes into play. And whether obviously we would continue to see these patients for as long as we can, but they're going to be out here longer than we're here. But, making sure that they know what they need from that follow-up standpoint too for the lifetime, and recognizing they need these certain specific labs annually and they need to follow with that and they need to be taking the vitamins and all of that. And of course, over time, I'm sure those guidelines are going to change and there'll be adjustments and that kind of thing. But, I think just recognizing, like you said, the importance of that and the follow-up care that goes with it.
Yes, it's a lifelong follow-up for anyone.
And I agree. Yeah, for him. Exactly. And that's not just for these people. I think too, looking at things like following with nutrition, like following with like a psych provider, those are also kind of things to consider of the longer term follow-up, because we are going to be looking at, you're going to be moving through a lot more stages of your life as a post-bariatric patient. So looking at when like I said, like when you transition from home to your own, whatever it is, dorm, apartment, house, whatever when you then do transition maybe to having your own family. And those are going to be more pivotal moments that a lot of our adult patients have gone through those changes.
Yeah.
And so feeling supported through that, through those big life events that so many people have already gone through, or getting new jobs and, heartache and all of these things that these like kiddos haven't had yet.
Yeah.
And that same, so nutrition, and then also the psych side of things of how are we coping through this? And, as your friends are doing different things, how are you coping with all of that? So I do think that it's, yes, from a health perspective, and we don't want nutrition deficiencies, and we don't want your muscles wasting away, and we don't want all these other things, but we also need to look at the mental health side of things for that longer term follow-up, which again, super important for all of our patients. I'm not saying that no one needs these things, but looking at it in this more unique population.
Yeah, we're going to, make sure that you have all of those resources. And that's a little bit about our program. So how does it work? Just like, oh, this sounds great. Maybe you stumbled upon this podcast and your child has been struggling. Maybe you're cool and you found us because we're super cool too. And you just found us. We're so hip here that you found us. You're like, you know what? These guys, like, I love their website. I love their vibe. I love this information. And you've been lurking on all the TikToks and all the things, like you have done more research probably than some of our patients in a lifetime combined, because you see it and you want it and you just almost obsess over just wanting to just achieve that. And you just can't, you just need a tool. And that's always what bariatric surgery will be. And so if you're interested, you go to our website, you get started, and we're all virtual.
Yeah.
So we want to make sure that for whether you're doing the medical weight loss side, if you want to start with that, if you've already done that, that, no, I need to get into the pipeline to do the surgical weight loss side. I just want to have a consultation to understand about my options. What's the program like? What surgeries do you do? I mean, I would do a sleeve and gastric bypass on, the same properly selected patient. And gastric bypass, if your BMI is over 45, if that means you have more weight to lose, if you have acid reflux, and if you're already struggling with type 2 diabetes or insulin resistance or PCOS and all of those things, even if you're 15, 16, 17, I would still recommend a gastric bypass.
Yeah.
And I think you can very safely have that. We have a whole episode on women's health type issues and pregnancy, because that's another big one. They're like, well, when my daughter gets pregnant, what's going to happen? I'm like, she's going to be more fertile, healthy.
Yeah, exactly.
All of those things.
Right. You're really setting up. And again, thinking back to kind of some of the causes of obesity, when we look at that can be a factor too, we look back at causes of obesity and overweight going back to when you're in the womb. I mean, it is legitimately, there's research that shows, just like we know with other health conditions. I mean, we know with supplementation and those types of things, what's really important during pregnancy. And that is something that can be a factor. So if you almost, again, looking at kind of breaking some of these generational issues, if we can then have these pregnancies be at a healthier weight and at a lower weight, are we potentially then setting up that next generation to not have some of these issues? Again, it's not going to change your genetics, but there's like the epigenetics and there's the womb environment and all of those types of things that play into longer term, and gestational diabetes and those types of things. Of course, that can happen regardless, but that's your placenta's fault. But we do know that you're at higher risk with higher weights and things like that. So there's other factors when we do pull back, again, looking at some of these higher level views.
Yeah, I mean, that's interesting you say that. Like, a lot of times I'll say, okay, how long have you struggled with your weight? And they're like, well, since birth, I was a 11-pound baby. Yeah. And it is kind of true. Yeah. And then you look at the pictures of your siblings or maybe everybody struggles, or maybe you're the only one. And it's just, even if they're young, even if you haven't had decades and decades of it still could be something that you have struggled with since the day that you were born. And, and we're here to help. And we're here to help in the properly selected patient.
And again, we're here to protect all the other organs too.
Yeah, we are.
Prevent these other problems from just being worse than they need to be.
Yeah. We want to either be preventative, improve, or resolve all of those things to break the pattern. If you have tried all the other things, that does not mean that obesity is a disease and we all preach it, but then it's like, okay, well, you did a little bit, but we're not going to give you the most efficacious option.
Right. Yeah.
We're just not going to give you access to it. We're going to make it really, really cumbersome that you have to do basically like months and months and months that turn into years. And then you kind of fall off the program because.
And then you show up 20 years later.
And then there you are.
Struggled this whole time.
It's like, yeah, I kind of thought about it when I was a kid, but I never really went through it. And so that's the other thing that we are wanting to do. And that is offer the most inexpensive competitive self-pay pricing in the United States.
Mhm.
So for sleeve bypass revisional surgery for adolescents or adults, right now it's starting at $10,999,
Mhm.
which includes all of it, surgery and all that. Why do I bring this up? Because right now I know there is an exodus of people who live in the US. They're going to Mexico and
Yeah.
taking their kids there to have bariatric surgery.
Yeah.
And I do think that again we're talking about the similarities and the differences. Sure, the 20 minutes to an hour procedure that you have, I'm sure it can be done safely there and you're fine.
Yeah.
But when it comes to I belong in this program, they get me, they feel me, I can turn to them, I can text them. Like, I think that stuff, I mean, should really just culturally or just understand that. I don't know. I think as a parent, I would feel more comfortable in the US,
Yeah.
I certainly don't want to, I'm not being negative towards any of my south of the border colleagues, but I do think that this is something that there's just no options that exist. And we really just feel stronger. We want to offer it.
Yeah, and I think it's just to the detriment of people too that it's not being offered.
Mhm.
It's just making more availability for it. It's the same with the adults. There's no lack of patients to go around. And I think just offering this as an opportunity and availability for these people again who would feel more comfortable being here and staying in the States and all of that. And who do know that the follow-up might be different and that lifetime care might look different
Yeah.
from a program
And I think a lot of it falls back on what is the negative cycle here? So, okay, you go to Mexico, you have this done. Then the care falls on the pediatrician.
Yeah.
And we have spent so much, we've already talked about the challenges, just, trying to navigate and trying to get the buy-in, the support, the referrals for the pediatric colleagues. And if all that they're seeing is these programs where there's just sort of like, sleeve them and leave them, I mean, and the next thing you know, it's like, oh, surprise, what labs do I even order? What do I do?
Yeah.
That's like a lot of responsibility. And I can imagine that that's met with a lot of, again, this is a hot topic, very controversial. They feel as though, kids are vulnerable. Like, we don't want them just to be like, without thinking of this thoroughly. But I don't know. I think we need to offer them something.
Yeah. Well, and I think that again, going back kind of the top of when we're meeting with these patients for the first time is really assessing the patient themselves. And we know that some of these visits are going to be with the patient alone. Some of them are going to be with the family members with that support system because we need everyone to have the knowledge. We need everybody to be on board with the changes and everything. But it is making sure that the kid is showing up and acting interested and showing, that they want this, that it's not mom and dad are saying, all right, we have to go to the doctor and we have to do this because that's when it's, we have to look at the appropriateness of it.
Yeah.
And that's part of the assessment. And that's also why we'll work closely with psych providers and colleagues to help us to understand where that kid is at emotionally and mentally. And are they ready, because they are still developing, they are still growing, their little brains are still developing and all of that. But I think that you can tell the difference in a kid that's ready and wanting to do this versus the one who's being dragged to the visit.
Yeah. If you're listening to our podcast and you found us, then that's, I think, one step already towards that. You want to get educated. You're just consuming all the information that you can find out there. And, how does it impact you in your life? And really, I mean, the upshot is this: bariatric surgery, low rate of complications, high rates of satisfaction.
Yeah.
And again, your lives, this is just kind of like setting the foundation of what the rest of your life could potentially look like. And gosh, that's exciting.
That is exciting.
Oh my gosh.
Yeah.
I remember when I was in residency, they did a little bit of adolescents, not much, but I remember this one picture, and this was like one of the moments where I was like, oh my, I want to do this specialty. I was looking through this book of before and afters, and I mean, the before and afters like always get me anyway. And it's like, you can just almost see like their faces change in terms of not just shape or size, but like happiness is like this dark veil has been lifted off of it. They're glowing. And I just remember, the one picture was, a girl who had surgery her junior year.
Mhm.
And then senior year, she was in her prom dress.
Oh, yeah.
And she went to prom. And it was just like things that like maybe you might take for granted just like by being in normal weight and you just don't even think about like where would I find the right dress that will look good
Yeah.
on me and I don't feel absurd? Do I even go? Do I have somebody to go with?
Yeah.
Do I have even a friend or if it's not like a
Am I
boyfriend,
comfortable?
girlfriend?
Am I,
Yeah.
physically comfortable? Like, do I have pain that makes me not want to go and participate in these things
I
too?
know.
Yeah,
I mean, it's just like I don't know. It's a heartbreaking thing. So
it is.
and again, we are super excited to get you guys out there and living, and we're going to be putting out so much educational content
Yeah.
about this.
Yeah, so tell us what's hip, young people.
Yeah, please tell us again. Yeah, tell us what
Tell
you
us
want to
what
know.
you want to see. But that's the other thing is I think we do. We want the feedback from if you are listening to this and you do have questions and you're like, what's out there. First of all, you can always have a consultation. And if you decide this isn't for me, that's fine. We're not here to force anybody to
No.
do anything. But if you want the education, you can get the consult, talk with a surgeon, like do it and just see how you feel. But if you have other specific questions, send us a message. We're happy to answer. We're happy to, we're going to be working on, this is all very brand new. So we're going to be working on the education material. We're going to be working on the videos, the social media, this outreach and stuff. So we want to tailor this so that not only are you getting the information that we know you need, but you're getting answers to the questions that you have, because we may not think of some of these things because we're just two old ladies.
Yeah, we are. And I'm a lot older than you, but yes, we know, but we're fun. And
We're fun.
I mean, my brain is we're just spinning right now. I'm like shopping with Hannah as you and this teenager are just going to the store for the first time.
Though.
I know, like what recipes, like, or even like substitutes. Cause sometimes it's like, oh, I really like X food. We talk about this all the time. Like I snack on this. I get home from school. My habit is I grab this. And then, okay, well, here's a great alternative that is a lot better and it still like satisfies that sweet tooth or that just that need that you have.
Crunchy, salty.
Crispy, crunchy, salty.
That's what everybody wants in a snack.
There you go.
It's a pickle.
It's a pickle. Wow. Well, okay. There you go. I like pickles, but still.
I know.
Oh my goodness. All right, my friends. We'll go to BodyByBariatrics.com and check out if you're interested in becoming a patient and learning more about our pediatric, adolescent, ages 15 and up, medical and surgical weight loss programs that we have. Yep. And as always, Dr. X Dietitian.
Yep. Find us on Instagram at DoctorXDietitian, on TikTok. BodyByBariatrics.
Yeah.
Not DoctorXDietitian. We need to fix that.
I mean, geez.
Oh
I'm just slow at those.
We're slow. So we'll get there.
I know.
Our website, DoctorXDietitian.com. You can find Dr. Dovec at Dr. Dovec. You can find me at hannahschuyler.rd. And if you somehow still can't find us, that's a problem. But
that is a problem. Maybe we
just Google us.
Google us, and if you can't find us, maybe that's the bare minimum. Like, okay, we're not quite ready for this
yet. Right. So find us. Like I said, we would love to answer your questions. If we need to do a follow up on this, we're happy to do that. So reach out, and we will look forward to speaking with you soon. And we'll see you next time.
Let's do it.
All right. Bye.